Well, joining us this morning, our friends from Titusville Area Hospital. We have Kelly Clark and we have Dr. Charley Gates. Good morning. Good to see you this morning.
Good morning. How are you doing?
Great. How about yourself? You doing
Really
good?
good.
Dr.
Good.
Gates, how are you?
I'm doing very well, Luke. Good morning.
Well, welcome back. It's been a while. I was just trying to think. I think you came on when you first arrived. How long has it been?
I'm in my third year now,
Wow.
so we're moving along.
Well, congratulations.
Thank you.
I hear things are going great. The lunch series up at the hospital has been just fantastic, providing a lot of information. A lot of people have questions. So you've been busy.
Been busy and getting busier, and we're looking to continue to grow the practice, and that's why it's so nice to be back on the show here with you and see you again and have the chance to speak a little bit more about things that are happening up at the hospital.
Well, let's get into it. Just kind of, for those who might not be familiar with you, tell us about yourself and about your practice.
Yeah, definitely. So my name is Charley Gates. I'm a board-certified orthopedic surgeon, born and raised in Pittsburgh, spent 10 years in training at University of Pittsburgh Medical Center. Practiced in Pittsburgh for a while, but just didn't really love the big city with regards to the way medical care is practiced. There's too much competition amongst doctors, which leads to unnecessary surgery, honestly. And I'm a more conservative surgeon. I like to take care of the patient head to toe as a person, not just as a knee or hip to be operated on. And being in a place like Titusville, where it's an area of need. Before I got here, the previous orthopedic surgeon, due to health issues, was not operating. So we're doing a practice build and getting the orthopedic program back up and running. And that's been a challenge that I've really embraced, and it's gone well so far. I've been busier every year, which is great to see.
People are coming to you for what reasons?
Yeah, definitely. I mean, so I'm a general orthopedic surgeon, which means, and the majority of things that I do, I would say, number one, total knee replacements. We're doing a lot of those, and we use a custom implant, which is an American company called Conformis, that manufactures patient-specific cutting guides that really gives patients a great fit. So it's probably the thing that I'm most excited about that we're doing is total knee replacements here. Also, of course, do fracture work through the emergency room, broken hip, wrists, and ankles. Do hand surgeries like carpal tunnel surgeries and trigger finger surgeries. And then do the arthroscopy procedures like shoulder scopes and rotator cuff tears and knee scopes. So there's probably 7 or 8 procedures that I do that make up about 90% of my practice, and it's a nice bread and butter general orthopedic surgery practice for a small town like Titusville.
Going back to the knees, this is fascinating because, and I could be way off on this, but would it be like going to try on a shoe, but they only have sizes like 8, 9, 10, 11, but I need like a 9.5. So what you're doing is really providing a custom fit that is maybe, be a lot better fit than just the standard replacement.
Yeah, you got it. That's a good analogy. And the one that I use in the office with patients is I tell them, imagine if you went to Macy's to buy a shirt and you've got small, medium, large, and the medium fits pretty good, but it's not perfect. No one would say it's perfect. Now, if you go to a tailor and the tailor measures you, and your right arm is a bit longer than the left one, and your chest is a certain size, and so you come back 4 weeks later, and the tailor's got your shirt for you, and you put it on, and it fits like a glove. And that's what Conformis is like. The other big orthopedic companies, they use off-the-shelf implants, which is literally size 3, size 4, size 5. Nobody is a size 4.000. And so what you're getting is a little bit of robbing Peter to pay Paul, where it fits pretty good. And honestly, pretty good is often good enough. I mean, it's better than nothing. When you're bone on bone arthritis, pretty good works. But always looking to get better and always looking to take the next step forward. If you can get to a point where you've got a custom answer to each patient, that's the best thing. And what Conformis does is when we start the process, and it is a process, and I walk down this road with people because it's a journey. We start with the non-operative things, injections, living with it, braces, canes, anti-inflammatory medications, physical therapy. Some people walk in the door having done all that and they're ready for surgery right off the bat. Happy to do that. Happy to go right to the operating room. Other people want to come and talk, and we have information handouts, and I sit down and I talk. Once we start the total knee process, the first thing we get is a CT scan of the knee. A CT scan is an advanced imaging study. The computer takes hundreds of images of the knee. Those images get sent to Conformis. Conformis is an American company that then has a software program that builds cutting guides based on that person's knee.
Oh, wow.
So, and it's additive manufacturing, which is 3D printing. And those get produced and sent to me, and those are for that patient. If something happens to that patient, if they move to Florida or they disappear or they decide they don't want it, we can't use those. We send them back to Conformis. They are literally a snowflake fitting only one person. But that lets us give that great fit, which I think patients really appreciate.
How often do you hear afterwards, I should have done this years ago?
A lot. In fact, a lot of my total knee replacement patients are bilateral. So that means they do the right one. And I just, the other day, had someone at the first visit after her knee surgery, she said, how soon can we do the second one? And so I was delighted. I mean, a lot of people do that where we've done either they're so glad they did it and their only regret is not doing it sooner. And some people are so happy and their other knee hurts so bad, they just piggyback them as quick as they can.
Wow. What is it? Is it just maybe they think of somebody they knew 20, 30 years ago that went through this, and, you know, rehabilitation took a while, and it just seemed like it just, again, their perception, maybe it took a little while to get back up and running, where now, you know, everything is changed. The technology, the expertise, it's incredible what can be done today.
No question. It's a total knee replacement surgery is a common surgery, and there's a lot of effort in industry and in the orthopedic community to continue to get better and better. And so in the last decade, there's been progress, and I anticipate in the next decade there'll be progress. And you know, I remember in my own life, 20 years ago, I had a knee surgery in high school, which got me interested in orthopedics in the first place. I had an ACL tear and had a knee scope ACL reconstruction. I was admitted to the hospital for 2 nights after an ACL surgery as a 16-year-old, which would be unbelievable in today's day and age. It simply wouldn't happen. And I have total knees that go home on the same day, and or go home on the next day. And so
that's incredible.
Yeah, so you are seeing improvements in techniques, improvements in technology. I think one of the things we're doing very well is the anesthesia side of it, which is the anesthesia team here is very good. They have a very good block that they use, which means you know, there's injections into the leg that happen before surgery, which put certain nerves to sleep, which really helps with pain control, mobilization afterwards. The way I tell people is, imagine if you're driving to Florida and it's a 14-hour car ride. If you can sleep for the first 4 or 5 hours and you wake up and you're a third of the way there, that's good. You know, and so that's what kind of the block does. It doesn't make it painless, no, but it does get you through that worst part, the first 12 to 24 hours. And so we've got the blocks, we've got a lot of other multimodal medications that diminish how much narcotics we have to use, which is good. So we really hit the pain scheme at a lot of different points. That helps the patient be more comfortable, cuts down their narcotic use, keeps their head clearer. You avoid all the narcotic complications like constipation and nausea, and so that's really helped us move patients down the road quicker. And I tell people they need as much time in the hospital as they need. If you're ready on the first day, we'll send you home, and if you're not, we'll keep you. We don't want you to go home and have a problem. And we always offer rehab. The hospital often can absorb a patient as a rehab patient and stay an extra week or two if needed, if there's not a lot of social support at home.
I was just going to ask about the aftercare part of it. How important is it to offer this surgery or any of these surgeries that you'd perform and know that the hospital has invested in those other supporting departments where that you can say, okay, now that we've done this, you have this opportunity for rehab. And we've invested a lot into that.
It's critical. It's so critical that I won't do a surgery unless a patient's willing to commit to the appropriate post-operative regimen. It is that important. And it comes up where people say, Doc, this is killing me, but I've got something I've got to do. I've got to finish my summer work schedule, or I've got my daughter's getting married. I have to get through that. Yeah, we'll get through that. You know, do that. Life happens. You're much more than just your knee or just your wrist. And so live your life. But once they're ready to commit on their side, the hospital absolutely has all the resources we need between physical therapy, between the rehab facility that the hospital serves as, and on our side. You know, we have a great staff in the office that answer questions that come up. There's a portal. I field questions. I would like to think that we handle questions very, very well and encourage questions. I always tell people, I'd rather have you call and ask something than silently worry about it.
You mentioned getting out of Pittsburgh, coming here. Is it partly, too, because they're not just a number, they're not just somebody going through the system, but you get to know them?
Yeah, for sure. Absolutely. I mean, here, you know, the patient gets individualized care. And in some of these places like Pittsburgh, I mean, you got some of these surgeons that run sort of multiple rooms and get into the double-digit surgeries in a day. You know, doing 12 or 14 total knees in a day. You know, and that's one style of medicine. My style is a little slower, a little more personalized. I'm not trying to break records of volume or set Guinness records. I mean, I'm trying to take care of the person in front of me as best I can. I mean, I really consider medicine a vocation, a calling, in the traditional sense. Service is very important to me. And sometimes service is not operating. I've had patients send thank you notes for things that I didn't even think I really did much. I didn't even operate, but it really meant a lot to them to either get an appropriate referral or to get some information to put them on the right path. Things that I didn't sort of value too much because I didn't have a knife in my hand, but they are worth a lot. And of course, when it does come to surgery, I take that very seriously, and those patients become in a special category because I've now operated on them. I mean, that is a bond that you have as a surgeon with the patient who you've operated on. I mean, they're in a special mental category for me where I'm really vested in their care and how they do. And, you know, as a surgeon, you have to be careful. You have to not take things too personally. You really do, because you have to, take care of them and not become too invested. Having said that, I am very invested and really care a lot about all my patients.
Sometimes, Kelly, a patient just wants somebody to listen to them, and maybe they're having a hard time explaining what they're feeling or going through, and to have somebody listen and try to diagnose and work through that. And again, guest after guest that you bring in, new doctors to the hospital, new employees, the supporting cast members. It's remarkable, and you get that similar story, right? It's about the patient. You know, we live in the community that we see our patients, and we're friends, we're neighbors, and we care about the health of the community.
Right, and really taking the extra time. We have a lot of folks, if you follow Dr. Gates' Facebook page, he has his own Facebook page for his orthopedic practice now. There's testimonial after testimonial of people saying the exact same thing, that Dr. Gates really listened to me, he listened to my story, and that is a lot of it, is taking the extra time to talk to the patient. You can go anywhere and have a knee surgery done, but that's the surgical part of it, and there's a lot of steps prior to that, which I know that me and Dr. Gates have talked about prior to that is really the overall care for the patient starts with the first appointment, and the surgery is kind of the last step. It is really great to bring all these special doctors on that definitely care to take the extra time with each patient.
You're watching The Morning Drill on Stream Television and on Armstrong's Neighborhood Channel. Kelly Clark and Dr. Charley Gates with us here this morning. Before we get back to Dr. Gates, Kelly, kind of give us an update of what's going on around the hospital.
So this is October, which is Breast Cancer Awareness Month. The foundation, the hospital's foundation, raises money all the time for Breast Cancer Awareness Fund. This fund allows for patients that do not have medical coverage, do not have insurance, and possibly cannot afford. It's a hardship for them to have their mammogram screening every year. So this fund allows for women to come in and have a free mammogram. They just have to call or apply for the voucher, and they can get a free mammogram. So it's a really good program. We take care of a lot of women. We have women that come back every year for this service because they don't have the appropriate insurance that covers that, or maybe they're not insured at all. This year we're doing something a little fun. We have a chair that is sitting in the front of the lobby. It's nice bright pink. You can't miss it when you walk in. So we are selling tickets that will be raffled off. We're doing the drawing on October 31st. So if you want to help support the cancer fund, Breast Cancer Awareness Fund, you can come in and buy a ticket, and you can support a good cause and possibly win a pink chair. So pretty exciting. We hope to raise lots of money. When we do our drawing, I'll release how much money that we've raised, but I know ticket sales have been going really well. Our auxiliary members are at the front desk selling those, so if you are interested, come on in and buy a ticket to win the chair.
Excellent. That's wonderful.
Yeah, so
And you'd have it just in time for the holidays.
yes, right? A nice pink chair. So we also have Dr. Panaru coming to the hospital. She actually just started. She is our new ENT doctor. She will be full-time at the hospital. Dr. Tay, which I know a lot of people know, he has been an ENT doctor with the hospital for quite some time. He is retiring in December, so she will be taking over the patients that we see there, and she'll be working alongside him and meeting a lot of the patients that have a relationship with Dr. Tay. So it'll be a nice switch over. We are sad to see Dr. Tay leaving, but we're glad that we found a really great replacement for him.
That's excellent.
Yeah, so that's what's going on in the hospital. We also have Oak Street Pediatrics is having a flu vaccine for kiddos. If you have not seen the doctor yet, or maybe you're not due for your well check, if you just need for your kiddo to have the flu vaccine, you can come in for the clinic. It will be on November 8th from 1:30 till 4. You can make an appointment to come in during that time and get that vaccine.
All right. And they just call that number there.
Yes, call the 827-7004. That will get you to Dr. Muno's office, the Oak Street Pediatrics office.
So there's a lot going on.
Always.
Always something. Dr. Gates, how do folks get to you? Do they start with conversations with their primary care physician? Do they call your office directly if they're experiencing some problems or want to have a conversation? How does that work?
Yeah, you bet. They're welcome to call our office to make an appointment, and our ladies can tell if they need a referral or not. That's the best way. Just call us, and we're appointments are available, and we're happy to see people quickly.
Is it? You mentioned a lot of things that you take care of. Is it? Do you find that you're doing one thing more than another? Is it a nice blend of everything? I mean, it seems like every day is a little different for you.
A little bit. I mean, there's always lots of fractures through the emergency room. Always people fall. We're coming on to winter and ice.
Oh, yes.
And so there's a lot of falls, and actually on my Facebook page that Kelly mentioned, I'll be doing some posts on fall prevention, because I really do believe, by the time you see me, it's too late for prevention because it's happened. But fracture work through the year is always going to be there. Toward knee replacements, we've talked a lot about. After that, do a lot of carpal tunnel releases, and a lot of those people are very happy, because what's happening there is one of the principal nerves of the hand is just simply being squished by one of the ligaments in the wrist, and so we see a lot of carpal tunnel releases, and then a lot of shoulder scopes and knee scopes. A lot of meniscus pathology. The meniscus is one of the principal soft tissues in the knee that acts as a cushioning device, and in the shoulder, a lot of rotator cuff tears or partial tears that we see. So, yeah, it's a variety. It keeps us busy, and but we also stay in our lane, and I don't do anything that I wouldn't do very well.
And the ages vary too, in terms of the patient age. Again, that's got to be interesting. You could be working on somebody, young, somebody older. Every day would be different in that department.
A little bit. In the office, we do see, anything from children to retired folks. In the operating room, it's mostly an adult orthopedic practice that I have. I don't operate really on any children. That's what children's is for. Erie and Pittsburgh have excellent orthopedic children's programs if surgery is needed for a child. So mostly I'm in adults, with adults, and honestly, once you're mature, by mature I mean, growth plates are closed, there's not much difference. In fact, younger adults are almost always healthier, which means makes surgery a little bit less risky, which is always good.
Could you tell my wife that I'm mature then, just based off of what you said?
Luke is mature.
Thank you. That's great. Kelly, if folks have questions about anything, what's the best number to call?
Yes. So if you're looking to get an appointment with Dr. Gates or have questions for Dr. Gates, you can call his office. It's 827-9770. If you want to discuss anything further what else we talked about, you can contact me directly at 827-1060.
And you can like the hospital page, and you can like Dr.
Yes.
Charley Gates' Facebook
Yes.
page as well. So
Right. We're
Great.
trying to put out all the information. So yes, you can visit both of our Facebook pages.
always good stuff. Good to
Yeah.
see you. Thank you.
Thanks so much
Thank
for
you,
having
Luke.
us, Luke. Appreciate it.